Hello, hello. My name is Dr. Ashley Parks, and I will be sharing with you a little bit about community health needs assessments today. Now, community health needs assessments, as you likely know, have a lot of different names. So if you look them up, you'll see community health status assessments, community health assessments, and there's different models and practices that are used and different branding, but essentially we're talking about looking at the needs of a community very broadly. All right. So to get started here, I want to talk a little bit about reliable data. So when we conduct needs assessments, we need reliable data. We have to design our needs assessment, be it that we're getting secondary data, so maybe information from the CDC or the National Center for Health Statistics, or collecting our own primary data. We might be doing a little bit of both. And we use that information to create a statement of need and build a larger overarching plan for our program, right? Based on the data that we see. And so today we're talking about the assessment piece of our public health planning cycle. My background is as a health services administrator, so I would love to have additional conversations with you all about public health admin and about healthcare admin, a little bit different. But today we'll focus on the idea of conducting this initial assessment and how it can inform work that we do both in healthcare and in public health. All right, so with designing a needs assessment, we have to understand what a need is. And a need is the difference between the present situation we're in and a more desirable one, a future state in which everybody is healthy and well. And depending on the problem that you're focusing on or the issue you're focusing on, it may be a future state in which everyone has mental and emotional well-being, or it may be a future state in which everyone has access to mental health services or access to physical health services. Needs are subjective, but basically you're saying we are missing something here. Someone doesn't have a service they need, someone doesn't have a type of health or well-being that we would like them to have, right? It could be all sorts of issues. So the need is all about helping our population move to that better state and understanding the gap between where we are and where we want to be is the need. So there's a lot of processes designing a needs assessment. And I happen to teach a program planning class for graduate students that uses the McKenzie textbook, which is another text that I love to use. And so you'll notice some of my notations and things are borrowed from that textbook. Anyways, this is a view of the 6 steps to a key needs assessment. We have to decide what we're going to do, our purpose. We have to gather the data, the information, and analyze it. Make sure we're focusing on the key risk factors, decide where to focus our program, make sure we validate the need, talk with the community, and make sure we're getting it right. So we start out by defining our purpose and scope. We have to know why we're conducting the community health status assessment, community health needs assessment. What are we looking for? What are we focusing on? And sometimes it's very broad. I've worked as part of health departments where we're assessing the health of the community very holistically. And we're looking at diabetes, and we're looking at cancer, and we're looking at walkable sidewalks. We're looking at everything. But quite often, it's a funded or specific project where you're really only looking at the needs of a certain population or as it relates to a certain health area. It depends. So determine your scope first. Is it very broad or is it very focused? And does it need to align with state, local, national priorities? And if so, Healthy People 2030 is an excellent resource. If you just Google Healthy People 2030 or click on the link, it has all the national goals around very specific health indicators. So you can see where your area falls in relation to those goals and in relation to those benchmarks. And of course, we want reliable sources of data. We're not just pulling news articles or random pieces of information, right? We either use the library or Google Scholar if we're looking at peer-reviewed information, and we really screen what is appropriate. But in a lot of cases, we're looking at data sources. And so this next slide here has a listing of example data sources that are appropriate. Something like the BRFIS, the Behavior Risk Factor Surveillance Survey, Behavior Risk Factor Surveillance System that administers a survey through the CDC. We also have a youth version, the YERBIS. And that's not all, right? Between the Center for Disease Control and Prevention and SAMHSA, the Federal Mental Health Services Administration, all of those groups have lots of data sets. For example, the National Survey on Drug Use and Health, NSDUH, if you Google it, has tons of data about every health indicator you could imagine, but also drug use. They ask all sorts of questions about mental well-being and physical health and drug use. There are a lot of different data sets out there that you can pull from. And if you're in California, you also have access to the California Health Interview Survey, which is a data set I used to work with for years at the UCLA Center for Health Policy Research. They have some excellent data. So if you go to askchis.com, ASKCHIS.com, it takes you to a data set that has all sorts of state, local, you can even get zip code data related to the health of California. It's very cool. So we gather data. We either gather primary data, surveys, focus groups, conversations that we have in the community, or we look at secondary data. And most of the time we do both, right? We need data online that says, guess what? Ventura, California has a higher rate of a certain condition. But guess what? So does Camarillo, so does Bakersfield. It gives us an idea in general, looking at secondary data sets. And then you can have conversations with the community. You can survey them on their current health behaviors, how they feel about those health outcomes, how ready the community is to do something different, to change. This is an excerpt from a local health department that I've worked with in their needs assessment, 2014 to 2015 in Knox County out in Tennessee. And they took a lot of secondary data and they went and they talked to their community. They did 12 focus groups, so groups of people talking to each other about planning for programs, and they did 26 key informant interviews. Really cool process. They also looked at that secondary data. They looked at the BRFIS and the URBIS surveys to look at self-reported physical and mental health. There's lots of ways that we collect that data as part of a community health needs assessment. We can do surveys, which are also known as cross-sectional surveys. If it's at one point in time, we're asking somebody for their thoughts or perspective on something. We can do a multi-step survey where we come back multiple times to the population and ask them to validate and share their thoughts. It's also known as the Delphi technique. We can hold community forums and town hall meetings, or have groups of people get together in a session where we have a moderator ask them questions and they discuss it as a group. That's a focus group. We can also add a couple levels of sophistication to that and do something called nominal group process, where we walk a group of people, members of our priority population, through a set of exercises to talk through the data and talk through planning. We can also observe and go out in the community. And I love doing this. It's called a windshield assessment. Get in your car and drive around, see what people are doing, take photos, talk to people. And then of course we can do self-assessments where we ask people to assess themselves. You can do health fairs and different events. Lots of different ways to collect data for our community health needs assessment. When collecting that data, we can do surveys, right? We can do surveys in the mail. We can do surveys in a group setting like a classroom or a health class. We can go door to door and talk to houses, individuals in their houses. We can survey people at the time of transactions, point of experience when they're at a healthcare center. And of course, via email, and even across many, many channels. Lots of different approaches, and we can interview people as well. And so these are different approaches, and the interview includes focus groups and interviews online, interviews in person, but these are different approaches to getting data from your local community to add to that secondary data or information that you found online. Now, I want you to think for a moment about what type of survey works best for different groups. For example, if I'm surveying group 1, elderly Americans, ages 65 plus, I might mail them something. I might go by their house and talk to them or ask them to fill it out at a healthcare center, at a point of experience. I may even come by and interview them, talk with them, call them. That's very different than if we're talking about homeless individuals. Number 5, people who are displaced. Those folks, I'm not going to mail them something in the mail like I would someone who's a senior. I may not do a group, may or may not. There's no household drop-off option, right? I'm not going to call them, but I may go out in the community and talk with them, personal interview, right? Or at a point of experience, maybe at a soup kitchen or a shelter, right? So it's different, your approach, depending on who you're working with. You also have to decide what data to include based on what is really important and key for your project. So certain things feel urgent. Problems in your community, changes in your community. Unemployment during COVID was urgent. It was also important, but it was urgent in that it was new, that shift was happening. So urgent means it's happening and somebody has to do something about it right away. Important tends to be these permanent or constant issues of high importance. So we need to focus in program planning and in community health needs assessment on what is really important and urgent. We don't focus on something if it's not the key issue. And I'll give you a quick example. Early on in my career, I worked with a lot of different locations, sites. And one thing that I was working on was a CDC-funded REACH Corps grant through the UCLA Center for Health Policy Research. And on that project, I went and talked to moms, family members, parents of children living in Boyle Heights and Long Beach. And we were talking to them about the effects of traffic, air quality from emissions, vehicle emissions and traffic on their families. What was the potential effects? And when I met with them, they said, excuse me, random person, I don't really care about traffic or air pollution right now. I care that my kids aren't safe walking to school. I care that there's gun violence. And so it was interesting because to them, that was important and urgent. What I was talking about wasn't, even though it was what I was funded to do a whole MAP planning process around, a whole focused effort through the CDC. So it's interesting how we really want to make sure the community's guiding this and we're capturing what they think is important and urgent. Also, we have to think about how we collect data and how we make sure urgent issues can come to the forefront, right? We're not so focused that we miss out. So let's say we talk to a student population, and I happen to work with another university, UT. Let's say we're talking with a student population, and they're telling us they don't have enough places to eat on campus. Their food choices aren't healthy. Food outlets are too expensive, and the lines are way too long. What's most important out of that? Well, assuming they're getting enough to eat, I don't think variety is the issue. Probably health of all of these things. Maybe expense, but you notice it becomes a little subjective. It's based on your perspective, how price sensitive you are. Okay, so we, of course, want to analyze data and incorporate data that's important and urgent and focus on problems that are important and urgent. We also want to focus our effort on things that are high impact, things that are going to accomplish a lot on this side of this grid, high impact. Sometimes it's high effort, you got to work really hard to make an impact. It's wonderful when there are small things that we can do to have a huge impact, low effort impact. But we want to stay on that high effort side if we can. And sometimes it's a little effort to make a little impact and you say, oh, it's worth it. But in general, we want to focus on making an impact. Right? And so that's the data that we focus on, things that we can impact. You often hear low-hanging fruit, things that you can do something about right away, low effort, high impact, things that you can solve. So once we've analyzed some data and we've collected the data from the community, analyzed it, we have to distill it down into the key risk factors. Things that we think are important that are leading to these health issues that we can do something about. So things like social determinants of health, the conditions in which we are born, grow, work, live, and age, where we're at, where we work, what's going on around us. And of course, social needs. Those are things like food insecurity and housing instability, right? Do you have somewhere to sleep tonight? Do you have access to food? Are you a victim of interpersonal violence? And I hate to use the word victim, but are you someone dealing with that? Are you someone struggling with that reality? So those are social needs that we have to address, and we address them by trying to address social determinants of health, making sure that people have a safe place to be. These are risk factors that lead to health issues. So we want to identify the key risk factors so that we can address those health-related social needs and address the broader social determinants of health. Now, it's important to note the difference between these. So with social determinants of health, these are downstream effects. If we change the community, the health of individuals also changes, right? If we have safer schools with better education and more opportunity for everybody, we expect a healthier population. Social needs have upstream effects. If we change health, we can change social needs. For example, if there are more mental health services, when somebody's going through a crisis at work, they're less likely to lose their job and end up being displaced or not having a home, right? So we're addressing, so that's where healthcare comes in. We can address social needs, and that becomes self-protective too. So it's almost circular, but there's an up and down motion. So these are some program examples with two different sets of approaches. And you can see we have the social determinants of health approach next to the social needs approach. So let's say we have a lack of public transportation. People cannot make it to their doctor's appointments at the free and charitable clinics because they cannot get there. Well, a social determinants of health approach is a permanent bus route in the community. We put the bus there, we make sure it's cheap and or free. We have a bus route that's there. It is now a fixture of the community. It exists permanently. That is social determinants of health. A social needs approach is more specific to individual needs. If they don't have transportation, you give them a bus voucher. And really, we need both, right, in this case. Poor healthy food access. So there's no access to healthy foods. Okay, so we create a farmer's market in a food desert. Okay. That's a social determinants of health approach. As long as the farmer's market exists, right, we're filling a gap, hopefully. A social needs approach for that poor food access is to implement a produce prescription plan at a local area hospital, where literally they give out produce at the hospital as part of your prescription. You've been prescribed 5 carrots this week, right? The idea of that. It's individual focused versus something that's just in the community. So social determinants of health is broader and community-based approaches versus a social needs approach is more specific. And another great example here is low vaccination rates. So let's talk about that one for a second, because with COVID, I think most of us are familiar with that. If we have a mobile vaccine clinic that travels to neighborhoods, that is a social determinants of health approach. Versus if we just vaccinate at individual doctor's appointments, that's a social needs approach. When someone needs the service, they get it. So both important ways to think about things, but if we can address them at a broader social determinants of health level, we tend to have a longer impact. Okay, so far, go back to me for a second. We've collected data, we've analyzed data, we're focused, we've identified the key risk factors we want to address, and now we decide what to do. We identify our program focus. We know what we need to address. What's the program going to do? And we pull examples of programs that already are doing this, pilot programs or example programs, best practices. We look at how effective those are, what worked, what didn't. We review the literature and we start to think about how we could adapt for our population. And how we start that process is by validating the need. We recheck all our steps. We make sure it really makes sense that we have focused on the salient points, that our community health needs assessment captures the most important needs for our community. We get a second opinion from experts. We talk with local health department, health services folks, making sure that we've captured it holistically. Now that we've talked about those steps, once we're done with step 6, we're ready to implement. We're ready to build a program. But I want to talk for a minute about some special types of health assessments. Other types that are kind of under this broad umbrella, but you may start a project and think it's just a traditional community health status assessment when really it's one of these. One of them is HIAs, or health impact assessments. And this is a systematic process that uses an array of different data sources and analytical methods, just like we have, to consider input from stakeholders to determine a future policy program. So you may say, we want to build a new hospital. What is going to be the health impact? We want to build a factory in the town. We want to put a freeway through our small town. What is the health impact of that specific policy plan or program, that effort on our community? So that's a health impact assessment. The impact of that change is what? So we do assessment all around that change. We also, especially if you're interested in working as a health services administrator versus too far on the public health side or further on the public health side, you may do an organizational health assessment, where you look at worksite health programs for your employees. You look at the health of your organization and make sure that you're doing what we call designing reasonably designed wellness programs. So the ACA has guidelines, Accountable Care Act, Affordable Care Act, I apologize. It's an Accountable Care Organization and an Affordable Care Act. Affordable Care Act dictates that we have these reasonably designed wellness programs that incorporate all of the needs of our employees. So that's an organizational health assessment. Okay. So with conducting a needs assessment, a good needs assessment should answer all of these questions. And I think going through the last several slides, we've done this a little bit. We talked about these elements. You have to know who your priority population is. Is it the community as a whole, or are you focusing on a specific population and their needs? What are the needs of this population? What did you uncover in the data? Why do these needs exist? What do we think the root cause is? What do we think created this need from a social determinants of health perspective? What's driving this? Are there subgroups of our community that are of the greatest need that we need to address? Where are they at? Are they in certain communities, certain neighborhoods geographically? Do we have resources to address these needs? What additional resources do we need? How are we currently addressing it? And how well have these needs been met in the past? Where are those big gaps in what we've been able to do? And that helps us design a full statement of need. And so we put together a document that establishes what we want to do with our program or effort going forward, our department, our plan, our organization. With program planning, normally you're planning a very specific plan of action, right? It has to be a concise, coherent, cogent needs statement that says, this is what our issue is, this is what we're going to do about it. And oftentimes it's part of a larger grant application. So I've linked in a grant application here that I wrote where the needs assessment is just part of the full grant plan. It's just the beginning. It's just what the community needs, and now we're going to do all this stuff, hopefully, to better address the community's needs. So we take the needs assessment, all the data we've gathered, we've narrowed down our target population, we put it into words. That's our statement of need. Now there's some general rules for that. We want to make sure it's local, it's focused, it's not too broad. It can be about a national problem, right? We can look at diabetes in Ventura County. We can look at heart disease in Riverside County. We can look at, food insecurity in Knox County. We can look at a lot of different factors. But we have to assume that a national problem is not automatically a local problem. So you have to get local data. You have to make sure that just because obesity is a big issue in general, is it really an issue in your community? And is it the top issue? So ask yourself how you know there's a problem and make sure you have the data to back it up. This is a good example of one of the communities that I live in and work with, and it's food insecurity in East Tennessee. It's lots of different counties. And you plot the national average and you can tell, wow, Scott County has a lot more food insecurity than the national average. Blount, though, and Loudoun are about national average. So where do I want to focus my resources? And are there certain communities, even within those counties, that have a greater need? So with our statement of need, right, we want to make sure we've got the evidence, the data. Some of it's going to be thoughts and feelings and perspectives, qualitative data. And some of it's going to be numbers and rates, quantitative data. We want to make sure we're comparing to the nation or the state so that we're showing, especially if we write a grant, that we have a true need, right? So if we say the poverty rate is 15% compared to 12% in the state and 12.5% nationally, that shows something. That shows that we're suffering more, which is more of a justification for funding and planning. Make sure again that you're specific about the population you're trying to help and why this need is urgent and important. Has to happen now. And then I've linked in an example here from some work we've done with the Harvest Foundation, and basically this is just a needs statement toolkit that tells you exactly how to write it. So take a look at this. This is a great resource I've used with students before in the past. All right, thank you so much. I hope this was helpful. Just a quick overview for you to start thinking about community health needs assessments. All right, have a wonderful week. Bye-bye.